It's hard to know what to expect when it comes to radiation therapy, and this video will help equip you with as much knowledge as possible so you know what's going on.
I've heard so many stories that made me feel quite anxious, but the team helped me get through it.
A huge advancement in radiation therapy is our ability to target the accuracy of the beams down to the millimetre. Radiation therapy works by targeting the cancer cells and minimising damage to healthy tissue and organs.
The team have an incredible attention to detail. They get you into the exact position every time.
Excellent, that's great.
When it comes to treatment, your radiation therapist will meet you and escort you into the treatment room. They'll position you in exactly the same way as you were positioned for your CT scan. They'll then leave the room, but will remain in contact with you via the TV monitors and intercom system. When the radiation beams are switched on, you won't see or feel anything different.
They'll come in, we line them up, get them nice and straight, take an image, give them their treatment if the image is matching the image that we took on the CT on the first day.
Radiation therapy is painless, and while you do have to lie very still during your treatment, you'll be able to breathe easily and normally. It takes a few minutes for the team to get the machine ready for the radiation therapy. The radiation therapist will leave the room and control the machine from a separate room. If you have any questions, you can always ask the therapist over the intercom.
The radiation therapist left the room, but they talked to me over the microphone all the time, so I felt they were there with me, that I wasn't on my own. And pretty soon, the treatment was finished.
It's important to let the radiation therapist know right at the beginning if you're not comfortable, so that they can adjust your position.
The machine made some whirring noises, but you couldn't feel anything happening. You just need to remind yourself to stay still.
A number of patients are understandably concerned about the time commitment and the impact on their normal life in having radiation therapy as part of their overall care. The reality is that the treatment itself is over in a matter of minutes for the majority of patients. The actual time that they spend on what's called the treatment couch or bed is probably about 10 minutes.
You can take comfort knowing that the radiation therapists are right outside the room and we can see and hear you at all times.
One of the common concerns is, will I in some way be radioactive? Can I nurse children, be near other adults? And we can reassure people that they can live a normal life in that regard. Many of our patients drive in, have treatment and drive home or to work.
Once treatment is over, some patients have difficulty letting go. Rest assured, when you've completed your treatment, we'll monitor your progress closely. You'll see someone from the team caring for you once a week while you're having treatment. They'll ask how you are and ask about any side effects.
Aftercare following a course of radiation therapy is important, and we're finding now that as people are living longer, the care for people once they've completed their treatment is becoming increasingly important, not just for their physical well-being, but also for their mental well-being as well. And we are now actively getting engaged in helping the patient not just during their treatment, but to return to a normal life and monitoring them, over the years.
Yes, you are a patient, but first and foremost, you're a person. And we're not just treating your cancer, we're actually caring for you as a person.